Welcome to this webinar of the Jerusalem Press Club. I'm Uri Dromi, Director General of the club, and today we are privileged to host Dr. Shlomi Codish, Director General of Soroka Medical Center in Beersheba. Dr. Codish, thanks so much for taking the time to be with us. Why don't you start with saying a few words about Soroka, okay, if you please.
Sure. Soroka Medical Center is one of the 6 referral centers in the country, the third largest hospital in the country. And we're the medical center responsible for the 60% of southern Israel. The land area was the only large hospital in this area, which places a very significant strategic importance on our hospital in regular times and in COVID-19 times, much more so. We're part of Clalit Health Organization group of hospitals, health services, which is a major part. And the community we serve is very diverse, young, and has many special aspects in medical care and other elements. I think we're here for COVID, so I'll stop here and leave time for other aspects.
Okay, thank you. Israel is now entering its third full lockdown tonight, actually, and after surpassing record numbers of COVID-19 cases this week, and despite the national vaccination operation in which Israel leads in the world. But first of all, can you give us the latest statistics that you have, number of positive cases, deaths, those in critical condition, national if you have them, and specifically in Soroka?
So regretfully, we're seeing a surge in cases that is today beyond what we saw in the previous wave of COVID-19 illness. We're currently seeing 7,000 new patients daily. Over that, hundreds. We're performing a lot of tests, a lot of vaccinations, but we're seeing a lot of seriously ill patients. We're currently at 873 critically sick patients nationwide, which is a number that is considered around the threshold of the healthcare system capacity. We're not beyond that, we're not close to that yet, but if the same patterns continue, the healthcare system will be significantly challenged moving forward, which is part of the rationale for this lockdown. If I look at Soroka Medical Center, we currently have 41 COVID-19 patients, but the real issue is we have 16 patients in intensive care, where we normally operate 24 intensive care beds. So these 2/3 of our regular intensive care beds are taken by COVID-19 patients. So this is a significant burden to any hospital. And while we have ventilators and beds and everything needed to increase our capacity, manpower, personnel becomes a challenge, nursing, doctors, and so on, which is a major rationale for the lockdown. Because if we can bring the number of patients down, leave the vaccine some time to work, and hopefully reduce illnesses, the risk of reaching healthcare system threshold will become lower.
May I suggest that journalists who wish to have more information contact your press secretary, okay?
Sure.
Okay, we'll do that. The purpose of the planned 2-week lockdown is to assist in slowing down the infection rates. What is your assessment of the prospects for this to succeed, given that the public seems to be tired of lockdowns and is not taking them seriously?
So this whole business with lockdowns and opening of lockdowns is a social deal between the government and the population. The deal says we're going to do a lockdown, we're going to bring illnesses down to a certain level, and we're gradually going to open various aspects of the Israeli society, schools, events, shops, and so on, while we monitor illness. And as illness increases, we will reduce what we opened and go back down. And that's the deal with an epidemic. That's what you need to do. There's no other solution. Regretfully, the public became wary of these measures, and the open, close sort of accordion movement we're talking about. And we reached a situation where the illness is reaching such levels that we need to implement a very strict lockdown. If we had better public trust, better understanding of what the deal really is here, we would have been able to implement less strict measures 2 or 3 weeks ago. Regretfully, we're now at a point where disease patterns are spiraling out of control, and we need to fully lock down the Israeli public activity altogether. This will work. There's no question. If everyone stays home for 2 or 3 weeks, police will be aggressively enforcing this. Then disease will come down. Vaccines will come into effect because we vaccinated, 1.5 million people, so that will reduce illness in society. We will still be subject to the same deal. If people lose their compliance with control measures, we'll see a forced lockdown.
Can I ask you, in general, what is your opinion about the overall management of the crisis? It seems that the political considerations overrule the medical ones.
So this is a tricky question. I think overall we're dealing with an unknown disease. Patterns of epidemiology, disease, we don't know what the mutation will do. There's lots of unknowns thrown into this entire equation. And it's very easy to be a backseat driver and say, this could have been done better. I think the government and the Israeli healthcare system are doing a very good job managing this effect. If there's one significant shortcoming, it's gaining the Israeli public's trust. And if you look what happens elsewhere in the world, every country in the Western world is dealing with the same issue. Countries who are less democratic find other solutions, much stricter measures that are not really possible in democracies. If you look at the vaccination that is underway now, Israel leads the world thanks to a very stable healthcare system, but also thanks to good government decisions made along the way.
What about the variant or variants? The British one, the South African one. Have you encountered them yet?
There, at least the British variant, the B.1.1.7, is around. It's underestimated in Israel because there's only one lab in the country that sequences the exact pattern. But viruses mutate. If you look at evolution, and we're talking, in human terms or mammal terms, it takes much more time. The virus replicates so quickly, there will be variants, and the vaccine will affect that as well. There will be a differential prevalence for mutated viruses who might evade the vaccine to develop. That's what happens with the flu every year. Currently, we expect that our common wisdom is that the current variants are covered by the vaccine because they emerged before the vaccine. So in all likelihood, it's not a result of the virus evolution to the vaccine. We don't know enough. I think every healthcare professional was not more humble at the end of 2020 or the beginning of 21, hasn't been paying attention. And we don't know enough about what these variant viruses will do. Currently, we should continue vaccinating with what we have because it's supposed to work. And everyone reads avidly every scientific words that come out, and we're waiting to see what happens.
What is the situation in Soroka regarding medical staff? Are they overworked, exhausted? Maybe the lockdown will serve as a relief period. What's going on down there?
So the medical staff at Soroka has stepped up in a very major way to deal with COVID. We haven't had a single problem with someone not wanting to work with COVID-19 patients. We're now we're shifting personnel around the hospital. So we're going to have nurses from orthopedics, from cardiac surgery working with corona patients to share the load. And everyone is stepping up in a major way. We have a very strict program in place to maintain staff's wellness. We don't allow people to stay in corona units over 3 months. We shift out. That's why we're moving to other professions. Our intensive care unit, regretfully, we don't have that luxury. There's not enough intensive care personnel to rotate. And we put a lot of effort into supporting our staff. So for instance, we build what's that in English? A gym.
A gym.
In the yard. We build a gym in the yard of our corona patient area so staff can exercise. We implemented Tai Chi classes, various other integrative care practices for the staff. It's a big deal. Maintaining staff wellness is key to being able to treat patients in a good way throughout this pandemic. and it's probably my major concern moving forward, as this moves on, is how to make sure that we have enough staff and staff that is well in all aspects, physically and mentally, to deal with this issue, which is a very big deal.
We focus on COVID-19, but what about the other, let's call them routine cases, the medical procedures that they are being delayed because of shortage of staff, etc. What do you see happening in this area?
So regretfully, as the pattern of diseases is increasing, many hospitals in Israel have been forced to close a small percentage of elective activity. We've been fortunate to not have to do that yet, but we have a plan for next week. Beginning Sunday, we might need to reduce some elective surgeries to clear staff to care for COVID-19 patients. We've seen in previous lockdowns about 30% patients stop coming to the hospital, even though healthcare is allowed. In the lockdown, people are more conservative and don't come in. So we'll probably see about same numbers now, maybe a little less. But if we see about 30% reduction in activity because of patients not coming in, so that will clear up some of that need as well.
What is your assessment of the vaccination process alongside the praise Israel has received for leading the pace in the world? Surely it has to do with the health organization, Kupot Cholim, and Soroka is part of Klalit, the biggest one. What's going on? What's the latest about vaccination? Because after the initial euphoria, we're now in a state of confusion, it seems.
I don't think there's too much confusion because the government has been saying what's going on. The first, from my understanding, is that the first batch of Pfizer vaccinations, or half of that, because we need to keep the second vial for the second vaccination, are almost used up. Israel purchased enough vials to vaccinate 1.9 million people. We're over 1.5 already. And we're preparing to start vaccinating the second dose next week. So if I look at Soroka, we vaccinated over 4,000 people in the first dose, employees and emergency healthcare providers. And on Sunday, starting with me, we'll start the second dose of the same 4,000 people. So currently, we're at our first round. There's Moderna vaccines on the way that will probably enter the same pool, and more Pfizer vaccines. As of now, we're not adding first vaccinees. This is a very big operation. Vaccinating, 1.9 million people is a very big deal in a small country. And you need to, bite off as much as you can chew to begin with. So this is a very good initial reaction. Vaccinating over 65s and medical staff was extremely clever because it will reduce the need of the medical system to be, in lockdown mode and in extra, extra care, not to become overwhelmed. So if we vaccinate, say, half of the over 65s, those are the patients who are most likely to become severely ill, require intensive care, and regretfully also die. So if I know that they are protected, I can be more tolerant of illness within the younger age group. We know that about 0.8% of COVID-19 patients in Israel eventually die, and mostly the larger age group, and they move through intensive care. So the initial dose of 1.9 million aimed at, one, strengthening the healthcare system by vaccinating healthcare providers, and two, aiming for the over 65s. And amongst those vaccinated, and there are people who, who are able to squeeze in, people who know someone who knows someone, and, got an extra dose, but they're a minority. And overall, our elderly population is making very good strides toward being protected.
The two populations in Israel, the Haredi, the ultra-Orthodox, and the Arab communities, where situation is not as satisfactory. And you mentioned that Soroka takes care of 60% of the southern part of Israel, of the Negev, where a large Bedouin community is located. What's the latest there? What's the situation there? Are they coming to take the vaccination? What is the situation there?
So first of all, I'll clarify the vaccination age is 60. I'm an internist. For me, the elderly patient is 65 plus. But yes, it was actually a clever move to move it down to 60 and enter some work age people, into the same group. So just to clarify that point. We don't have a very big Haredi community in southern Israel, and the communities we do have been fairly compliant with social distancing and vaccination. The Bedouin population is more of a challenge, a sort of a cultural barrier treating the entire disease throughout this year. We're doing a lot of work. We have a lot of experience working with this community and bridging barriers through religious leaders and through healthcare personnel. Issues such as genetic testing, prenatal testing, a lot of issues we have dealing with a different population on a day-to-day basis. And they are vaccinating less. The rate of vaccination amongst the Bedouin population is lower. Part of this, by the way, is because they have less elderly patients. It's a very young population overall. But part is this cultural barrier. The Israeli government allowed the vaccine doses to be broken into smaller lots this week, and we've been able to enter vaccinations into smaller Bedouin towns. So that helps a lot. And we're seeing a significant increase in vaccination rates. They're not reaching the Jewish community yet, and it's a big deal because these are smaller communities. People who live in closer, larger groups of people in smaller areas, and the possibility of the disease to spread is bigger. So we need to be very wary of the vaccination rate in this population.
Dr. Codish, you're also a part of the Ben Gurion University School of Medical Management, right? Or
yes.
Management. And you're into information, right? Medical information. Has the current crisis tell you something new you didn't know about spread of information? Maybe we come out of this as a world knowing more about what's going on in all parts of the world, China, etc.
Absolutely. Healthcare will be transformed following this pandemic. The trivial aspects are distant learning and so on, but part of it is public education and public engagement. Everyone on this call knows our world in data, and The Economist, Johns Hopkins, the various websites that have all of this data flowing in real time. The Israeli government, by the way, website has a lot of information on it as well. And we're all going to be a much better and much more informed public, and much more engaged in our management of healthcare through necessity in this case. The technology was there before, but it wasn't being used in the same way. I'm absolutely certain that people who are now dealing with specific mutations in a virus and can quote much more elaborate medical knowledge than ever before. This will translate to cardiac disease, to diabetes, to everything else. And people who previously felt maybe that the knowledge gap was beyond their capabilities are now feeling much better informed. The conversations I have with friends who are not in the field, are suddenly in the level of a fifth-year medical student. People are reading up. They're home. They have nothing else to do, maybe. But I'm sure these patterns will follow us, and we'll see a revolution in the way we deal with medical data and information following this pandemic.
We're all on Zoom now, and we might skip going to Kupat Cholim. You know the story that a woman meets her friend at Kupat Cholim, said, where were you yesterday? And she said, I didn't feel well, so I didn't come. So people will stop going to Kupat Cholim, and you can do it over Zoom.
As I told you when we were small talking before this, good luck trying to get me to a meeting in Tel Aviv after Corona. Right. Good luck trying to get me into my car to drive an hour and a half in each direction for a meeting of half an hour, which previously, was not something we thought twice about. And the technology was there before.
Right. Okay, so there's something good in this crisis. Finally, Dr. Codish, the state of public health in Israel. Do you think that once this crisis is over, the government will take it as a wake-up call to seriously reform and support hospitals, increase numbers of doctors and nurses, etc., or we'll just get back to business as usual?
I can only hope the government, well, I know the government is aware of, the shortage in funds in the healthcare system. Israel expends, significant percentage lower than the OECD average, less than half of what the US spends, but the US is an outlier on healthcare. The current estimate is around 2 billion or milliard, wherever you come from, Israeli shekels a year that are missing in the Israeli healthcare system just to catch up with the OECD. That's a huge deal. And the efficiency, so-called, in the Israeli healthcare system comes at a cost that we all see now. It is also clear that once this pandemic is over, everyone will stand in line, to match, to make up for losses. Certainly, the entire financial sector that suffered a tremendous hit here. If Israel wants to be prepared for the next big medical event, and it could be an earthquake, it could be another pandemic, it could be anything else, priorities have to change. The fact that we're standing well here throughout this whole thing comes at a significant future effect, and it's not sure that we'll be able to do the same if another disease comes sooner than 100 years. I will say that our success, say with the vaccination project, and also with the hospitals who are doing a pretty good job standing up to this pandemic so far, is due to the strength of the Israeli health system and largely the community part going into this event. We can discharge patients on oxygen to very good community follow-up that many countries in the Western world cannot do because the support infrastructure isn't there. And that means I can have 50% less patients in the hospital than, say, another Western country would have under the same community situation we have. So that's a fairly big deal and a key element in Israel's success, both on the community side, both on the hospital side of this pandemic.
Dr. Codish, we promised to let you go before 11:30, and we keep our word. Thank you so much for being here with us. We hope to see you again with more good news, hopefully. Please thank your staff for facilitating this. I want to thank Talia Dekel, our Vice President of Press at the Jerusalem Press Club, and stay tuned to our next events. Thank you very much for being with us today.
Thank you for having me. It was a delight.
We hope you enjoyed that briefing by the Jerusalem Press Club. If you did, like the video and hit the subscribe button to stay up to date with all of our future content.